Hello, my name is Coach Cockerham, and this is Health Education class. Today we're going to be talking about the principles of R.I.C.E. This standard comes from the Alabama Learning Exchange HE.1.4, purpose ways to prevent, reduce, and treat injuries and other health problems. So what is the R.I.C.E. method? When you initially get an injury, like a knee or ankle sprain, you can relieve pain and swelling to promote healing and flexibility with the R.I.C.E. method. This is rest, ice, compression, and elevation. Picture Next we're going to see a picture of the R.I.C.E. method that shows those four stages. And these four stages are very important because they help you get along with your healing process and to start to be able to move and get that range of motion back. So, is the R.I.C.E. method effective? I truly believe that the R.I.C.E. method is effective. You get a couple benefits from it. So when you rest, that's immobilizing and preventing further injury to the area that's hurt, and it also gives your body time to recover. Ice. Icing it is a process of using cold to reduce the pain and to numb that area that is affected. The compression, you use that to wrap to control your swelling. That helps keep that swelling down and also helps you to move around once you're able to apply a little bit more pressure. And then elevation. Elevating just keeps, and when you keep your affected area above the heart, that keeps the swelling down that's associated with that pain and discomfort. Rest. So resting, once again, that's just protecting that injury. When you need, sometimes you have to stop, change, or even take a break from an activity. Like if you're a runner, you're running and you roll your ankle. That's not going to be good if you continue to run on that ankle. So you have to rest. You have to give yourself time to heal. And during that time you're healing, you're going to be doing what's going to be the next step, icing, and you're going to get a little bit of that information on how you should ice and do things like that while you're resting. So with icing, like I say, this helps to control pain by numbing that area. You know what I'm saying? It also reduces the swelling. So you can apply right away if you can to help minimize the swelling before it gets a little out of control. But if you can't, it's okay. During the process of your resting, you should ice, you know what I'm saying, for 10 to 20 minutes, 3 or 4 times a day. After 48 to 72 hours, if the swelling is gone, then you can start applying heat to start promoting that flexibility to get range of motion back and to get back into your activity. Um, Also, during this time, you will use a compression wrap, and we'll talk about that. That'll be the next thing we'll be talking about. So, with the compression wrap, this is used to control that swelling. Once again, you want to wrap it you with a elastic bandage such as an ace wrap, and that's going to help to decrease the swelling. Do not have it too tight, and you'll know if you'll have it too tight because you'll start feeling tingling, increased pain, coolness, and you'll have swelling below the affected area. So, you want to make sure it's not too tight. You want to have it comfortable. And after this live, we'll see a short video, and you'll hear the instructor telling you that, you want to ask that patient as you're wrapping, is it comfortable for them? And then, like I say, this helps promote keeping the swelling down and things of that nature.
Hi, my name is Katie Brosnan. I'm a registered nurse here in Austin, Texas. And today I'm going to talk to you about how to wrap an ankle with an ACE bandage. The first thing you want to do is collect your supplies and get yourself in a position that you can wrap the ankle of the person best. So the first thing you want to do is take off a sock that they're wearing, and you want to make sure that they don't have any debris that you're going to wrap into the wrap, causing further injury. So the important thing to remember is that you're supporting the ankle. You don't want to do it too tight. You don't want to cut off circulation, and it's important to move from the toes up the ankle. If you do it the other way, you're going to be pushing all the fluid, and all the blood is going to be getting trapped down here, and eventually it's going to cut off circulation to the toes. So you want to start at the toes. Want to get a good base wrap to make sure it's not going to unravel. Okay, and then you want to be going in a figure 8 format. So the injury is over here. He's got a sprain, he's got a little bit of a tear, and we're going to give him some extra support. While you're doing this, you want to ask the patient, is that too tight? Does that feel too tight? Feels good? Okay. So continue with the wrap. It looking pretty is not the most important part. Having the support is the most important part. And sometimes getting the right fit means stopping and starting over again. And then you're gonna, some of these have little metal clasps, or they actually fit with Velcro nowadays. And so you'll just tighten that off, and you want to make sure that they still have good blood flow and cap refill to their toes. You're going to ask them, do you feel support in the right area? Do you have any numbness or tingling? And so that's one of the best ways to use an ACE wrap for supporting your ankle, for wrapping your ankle if there's some sort of an injury.
Now we'll get into elevation. And once again, elevation is just so you can once again promote taking the swelling down, and also to take the like some of the throbbing and the pain that comes with the area being affected. So elevate the injury or the soreness area on a pillow while applying ice or any time that you're sitting down. That's perfect for, you know what I'm saying, and that's something that they'll tell you, you know, when you have those kind of injuries. Whenever you're sitting around nothing, you must have it, you should have it elevated. And you want to try to keep it above the heart, like I say, because that'll stop the blood circulation from going all the way to that area, and that'll take the swelling down, and it'll take away some of that pain and throbbing that you're getting as well. Here we have 3 videos that also will be using that can help, that you can help to kind of give you some insight for the assignment that we'll have. So these videos are gonna, like I say, once again, just tell you about those 4 stages of the RICE method: the rest, the ice, the compression, and the elevation. And then it also will tell you a little bit about why you use these methods and what's some more great benefits of it. So for your assignment, I want you to just do a 1-page essay on why it's important to use the RICE method for acute injuries. And I also want you to explain in that paper, if you do not use the method for acute injuries, the effect and the consequences that can occur. So with this being said, I don't have anything else for you guys. I hope these videos can help you out with this assignment. I want you guys to understand that the RICE method is not just for, you know what I'm saying, acute injuries. They're also for you, like when you're just getting rest and trying to take care of your body. You know what I'm saying? Sometimes you need that, just that, especially with the icing. All this stuff helps. So once again, watch these videos, go through the slides again, put together this 1-page essay for class tomorrow, and we'll go over this stuff talking about the RICE method and the benefits and those things of why you should use it when you get an injury.